Babesiosis in Asiatic lions. Babesiosis is a tick-borne protozoan disease caused by parasites of the genus Babesia. In Asiatic lions, Asiatic lion, the disease can cause severe illness and mortality, especially when lions are stressed, immunocompromised, or exposed to large numbers of infected ticks. Etiology. The disease is caused by Babesia spp, which invade and multiply within red blood cells. In lions, infections have been associated with Babesia leo and other related Babesia species. Transmission occurs primarily through tick bites. Clinical signs. Affected lions may show fever, lethargy and weakness, loss of appetite, pale mucous membranes, anemia, jaundice, icterus, enlarged spleen, hemoglobinuria, dark or reddish urine, respiratory distress in severe cases, sudden death in acute infections. Pathogenesis. The parasite destroys red blood cells, leading to hemolytic anemia, hypoxia, organ dysfunction, systemic inflammatory response. Diagnosis. Blood smear examination showing intraerythrocytic Babesia organisms. Complete blood count, anemia, thrombocytopenia. PCR for species identification. Serum biochemistry. Treatment. Treatment protocols may include antiprotozoal drugs such as imidacloprid dipropionate under veterinary supervision. Supportive fluid therapy. Blood transfusion in severe anemia. Tick control measures. Prevention and control. Regular tick surveillance and control. Monitoring of lion populations. Early diagnosis and treatment of affected animals. Habitat management to reduce tick burden. Significance in Asiatic lions. Babesiosis gained particular attention after outbreaks among Asiatic lions in and around Gir National Park, where tick-borne infections were identified as contributing factors in lion mortality. This highlighted the importance of wildlife disease surveillance and conservation medicine. Viva competitive exam points. Babesiosis is caused by a protozoan parasite of the genus Babesia. It is transmitted mainly by ticks. The parasite infects red blood cells. Major lesion, hemolytic anemia. Diagnosis of choice, PCR along with blood smear examination. Important control measure, tick control. For veterinary entrance exams, GPSC, and wildlife disease topics, remember the association of Babesia infection, tick infestation, hemolytic anemia, and Asiatic lion mortality in Gir. All here is a compilation of the latest, real-time news regarding the recent babesiosis development in the Gir landscape, updated as of late May – early June 2026. Police cars revolving light headlines and current status, May–June 2026. Outbreak confirmed and under control. Gujarat Forest and Environment Department reported that 8 Asiatic lions, primarily young cubs, have succumbed to a suspect babesiosis infection in the revenue areas outside the Gir sanctuary. 0 new deaths in recent days. As of May 31, 2026, authorities confirmed that no new deaths or fresh infections have been reported over a consecutive 3-day period, indicating that the immediate spread has been contained. No widespread epidemic. State officials have explicitly ruled out a catastrophic epidemic, reassuring the public that the fatalities are localized and fall within manageable ecological pressures. According to the latest 2025 census, Gujarat's total Asiatic lion population stands robust at 891. Round push being geographic focus and transmission route. Affected regions. The cases emerged unexpectedly on the western borders of the Gir Somnath and Amreli districts, specifically concentrated around revenue zones like Gurgadada and Babrakot. The livestock interface. Experts note that these specific revenue areas feature a high level of interaction between wild lions and domestic livestock. Feral animals and livestock act as asymptomatic reservoirs for the Babesia tick vector, facilitating the transmission to lions sharing the peripheral lands. Lions under special care. Currently, infected lions remain isolated under strict observation at specialized regional facilities, including the Jamwala Rescue Center, Barbaria Forest Range, and Jasadar Animal Care Center. Advanced medical therapeutics. To combat the severe anemia caused by the protozoan parasite destroying red blood cells, veterinarians are administering blood transfusions, supportive for fluids, targeted antibiotics, and deworming treatments. Master ticking and barrier isolation. Wildlife teams have established a 10-kilometer containment radius around the affected infection zones, isolating local prides to check further transmission. Forest teams have successfully executed automated deworming and ectoparasite, tick removal, treatments for approximately 500 lions over the past 3 months using ring cage management techniques. Electric light bulb expert commentary. Environmental triggers. Principal Chief Conservation Officer Jaipal Singh pointed out that Babesia is a known endemic element in the ecosystem. However, sudden surges in transmission typically manifest during this time of the year due to extreme peak summer temperatures combined with high humidity levels, which compromise the immunity of younger cubs. Down to earth. The second home debate. Wildlife biologists, including prominent conservationists like Ravi Chellam, are using this recent cluster of tick-borne infections to reiterate the critical, long-term necessity of establishing a geographically separate second home, such as Barda Wildlife Sanctuary or cross-state translocation. Down to earth. Sources of recent news from Down to Earth. The Hindu. Hindustan Times. Local Gujarati newspapers. Commentaries from the Forest Department.